everyone, I'm Jen. I'm a cosmetic nurse injector here at the Clinica. Today we're going to be answering your questions on the very popular cosmetic treatment, dermal fillers. I've been a cosmetic nurse injector for 4 years. I took some specialized training at Centennial College and was trained by leaders within the industry. So what are dermal fillers? Dermal fillers are gel-like substances that are injected beneath the skin to provide hydration, give structural support, enhance facial contours, as well as restore lost volume. So the demand for dermal fillers has actually been on a rising trend for millennials. It's not a taboo anymore. So I find dermal fillers, along with Botox, are one of the main cosmetic treatments nowadays. So what areas can dermal fillers be injected into? It can be injected into the temples, the under eyes, the cheeks, the nose, jawline, chin, lips, smile lines, as well as the marionettes, the hands, and the neck. Dermal fillers can last depending on a variety of factors. So it can include where the product is being injected, how much is being injected, what is being injected, as well as the client's rate of metabolism. So highly mobile areas such as the lips, for example, tend to metabolize faster just because it's constantly moving. So that generally lasts for about 4 to 6 months. But for areas like the cheeks, the temples, the jawline, and the chin can last anywhere from 8 to 12 months. How much do dermal fillers cost? So the cost of dermal fillers depend on a variety of factors as well, depending on the expertise of the individual injecting the treatment, the risk of the treatment, so more high-risk areas would be more expensive. The geographic area of the location, so like the clinic, Toronto, would be more expensive than Hamilton, for an example, and the aesthetic result that the client is looking to achieve. So a more natural approach versus more augmented approach. What are the different types of dermal fillers? Dermal fillers are categorized by the substance that they contain. So at the Clinica, we use hyaluronic acid-based dermal fillers, and this is one of the most commonly recognized dermal fillers on the market. It's composed of a sugar molecule called hyaluronic acid, and it's found naturally within our body. What it does is it retains water, so when hyaluronic acid is injected into the skin, it retains water and gives our skin its moisture. Other types of dermal fillers on the market are polyalactic acid based, and there's calcium hydroxyapatite, and then the other one I know is just the hyaluronic acid. So dermal fillers are measured by the milliliter or by cc's. After the age of 30, we tend to lose about 1% of collagen each year. So for the rule of thumb in the aesthetic industry, we recommend 1 full syringe of dermal filler for every decade of life. So a client who is 30 years of age, for example, will require 3 syringes for full correction. Versus someone who is 50 years old, they will require 5 syringes for full correction. So dermal fillers, when you inject it into a teaspoon, it's actually 1/5 of a teaspoon, so it's not much. So we do recommend an in-person consultation to decide who is a good candidate for dermal fillers and how much can be injected. There are a variety of different techniques for injecting dermal filler. I personally like to use the needle technique because it is more precise. There is another technique called the cannula technique, which is a blunt end needle. The advantage of using this over the traditional needle is that there's less trauma, there is less discomfort, and less bruising. I would say the technique used will be up to the discretion of the nurse and what they're comfortable with using. High-risk areas, we would normally use the cannula over the needle technique. So for example, the forehead, the under eyes, we would normally use the cannula technique. So what someone can expect during a dermal filler consultation is that during the initial appointment, We do review your medical history. We look at your allergies, any medications that you are currently on, what you're looking to achieve aesthetically, the consent forms, as well as set realistic expectations of what the treatment can or cannot achieve. So to prepare for dermal filler injection treatments, we do recommend avoiding blood thinning agents. So this includes aspirin, Advil, fish, green tea, alcohol, ginkgo, as well as caffeine 24 hours before treatment. And then clients can also consume pineapple juice a couple of days prior to treatment to help decrease bruising and swelling. Clients are very concerned with pain. We do numb you with topical lidocaine, or we can provide ice as well for their comfort. So the entire treatment process and the consultation usually lasts around 30 to 45 minutes. So post-treatment, I do go over post-care, so what clients can expect after treatment or how much time they can expect to recover. And then we do have the client come back in 2 weeks for a follow-up appointment. So the results of dermal filler is immediate. It takes about 2 to 4 weeks for it to fully settle and integrate naturally into the tissues. Clients can expect to experience temporary bruising, swelling, redness, and tenderness at the site of treatment. So if the area is not properly cleansed or kept clean, you can get an infection. There are lumps and bumps that could occur within the first 7 to 14 days of treatment. We usually have clients come back in within 2 weeks for us to kind of massage and assess to see if everything's looking okay. We do recommend consuming pineapple juice and arnica to help increase the recovery period. So pineapple juice has an enzyme called bromelain to help decrease inflammation. So everybody's facial anatomy is different, so it's important that the injector is doing a proper assessment. During the initial assessment or the consultation, that's where the injector determines whether or not a client is a candidate for dermal filler injections. Some clients are better surgical candidates, so we do recommend coming in for an in-person consultation. So hyaluronidase is an enzyme that is used to dissolve hyaluronic acid-based dermal fillers specifically. It's found naturally within our body as well as in bee venom. So clients who are allergic to bees, like yellow jacket bees, we would perform a skin patch test to determine whether or not they would be an appropriate candidate for dermal filler injections. Hyaluronidase is indicated for overcorrected work, lumps and bumps, the tingling effect, which is a bluish tinge that is seen underneath the skin when dermal filler is injected too superficially, as well as help with vascular compromise. So for those who don't know what overcorrection is, it's when a client is overfilled. For example, we do see that a lot in clients who get their lips done, so filler that migrates outside of the lip. So the tingling effect is seen when filler is injected too superficially into the skin. So you can see a bluish hue underneath the skin. So vascular compromise is when dermal filler gets injected into a blood vessel, or when dermal filler compresses against a blood vessel. Blood can't flow through, so the tissue around that area dies. Hyaluronidase works immediately within 72 hours. It does take a full 2 weeks for everything to fully settle in. So we would normally reassess the client again within 2 weeks. So what are the long-term effects of dermal fillers? So there are no long-term effects associated with hyaluronic acid-based dermal fillers specifically, just because it is a sugar molecule that's found naturally within the body and it is dissolvable. But there is the risk of over-injecting and overstretching the skin. So clients can receive dermal fillers. It depends on the type of dermal filler being injected and how much is being injected. But on average for the lips, like highly mobile areas, I would recommend 4 to 6 months to come in for a touch-up appointment. And then for the under eyes and other areas that are not as frequently touched, then 8 to 12 months. So the results of dermal filler are not based off skin color. It is based off the skill of the injector, what the client is looking to achieve. If they're looking for more of a natural augmentation or they're looking for more of an augmented appearance, as well as the area being injected. There have been cases of clients who have experienced facial swelling with dermal filler treatments as well as the vaccine within 4 weeks. So we recommend not receiving treatment within the 4 weeks, but after that, it's safe. So I hope we answered all of your questions regarding dermal fillers. If you have any other questions, feel free to DM us at the Clinica or myself at Injector's Diary, and we will see you soon.